When you are suffering from pain, is it better to use a pill or a patch? Dr. Abraham Rivera from Florida Pain Relief Group joins us to give us some answers. Welcome, Doc. How you doing?
Doing good, thanks.
Well, we are excited you're here. And I mean, I see all these commercials these days for patches, injections. I mean, break it down. Let's start with this whole pain patch. How does it work?
Well, it's a delivery system. You're basically giving a medication through the skin, and it is absorbed through the skin, and it works. But it's a slow delivery system. It's a long-acting medication. It doesn't work right away. It takes time for the system to kick in.
Well, and of course, that's the patch. What about, injections and things that you can get at a doctor's office?
There's two kinds.
Okay.
There's the injections that your regular doctor, primary care doctor, can give you for breaking out an acute spell of pain. Typically, those injections are used to break out a migraine headache or to break out an acute spasm in your back and things like that. And of course, there is the other kind of injections that the pain specialists do to relieve pain by injecting steroids into joints or even into the spine.
I'll say, let's break that down a little bit. What can you provide that the regular doctor, a family doctor, does not in the injection world?
Yeah, these are deeper injections right around the spinal cord for herniated discs, for inflamed joints around the spine. These injections are only done by highly trained physicians using very sophisticated machines, fluoroscopy machines. It's a live X-ray machine, where the needle is guided right at a very strategic place in the spine using a live X-ray machine.
Make sure you get to that right spot. Well, let's just talk about then the other over-the-counter, the creams. How do those necessarily work? Yeah,
then it's again, that uses the skin as a delivery system, the topical formulation. Some of these formulations are very proprietary. In other words, each physician in town probably has his own blend of them, his own mix. They work. The problem with these things is, again, they don't kick in right away. They take time, so patients don't experience relief until days later after they apply it.
Is there an order that people should go through? Should you start, a cream first or a patch first and then the injection? What would you recommend for somebody out there?
It's all different for everybody. Really, anybody with a chronic pain condition should be evaluated by a pain practitioner and sit down and determine what options are best. Not a single medicine works for everybody.
Let's expand on that. How are you able to tell what's going to work for a patient, what's not going to work for a patient, since it's not a one-size-fits-all, if you will?
I hear you. At the end of the day, it's about diagnosis. Physicians have to listen to what's going on with the patient, compare what they're listening to the evidence on the x-rays and the exam, and make a diagnosis. And you'd be surprised. We have gotten so technical in medicine over the last 10 years. We're relying on imaging and we're relying on sophisticated MRIs. At the end of the day, the best diagnostic tool is listening to the patient.
Well, and I know you're able to provide that at your practice for sure. And if someone does out there, say they just tweak their back or they just, I've always heard misconceptions about, oh, you want to use heat, you want to use cold. What's that first step to kind of get them through the night until they can pick up the phone and call you?
Yeah, most people that sprain their back, if they leave it alone, it'll get better within 30 days, regardless of what you do. I do not do any better than the chiropractor or the Indian chief, for that matter, in the first 30 days. Most injuries, they get better by themselves.
So what would you recommend for someone if they just are a little sore and they can't wait the 30 days?
Yeah, that's right. You can get some over-the-counter topical remedies and anti-inflammatories. They can get some acetaminophen or any product like that. Some of the topical balms and even some of the patches, they have some validity.
Okay, that's what I'm glad to hear you say, but at the end of the day, if it's persistent, you got to get someone from your team.
Correct.
Well, for more information on the Florida Pain Relief Group, all you have to do is check out their website, floridapainreliefgroup.com, or give them a call, 844-KICK-PAIN. Thank you so much, Doctor. We appreciate your time.
You're welcome.